Okay, what I'd like to do is to discuss some of the many ways in which cognitive psychology is, in my opinion, having a beneficial effect on society. And perhaps the biggest problem I have is that there are just so many ways in which cognitive psychology is proving beneficial. But what I'll try to do is just focus on a small number of what I think is the most important of such contributions. For me, the single most important contribution lies in the area of therapy. Traditionally, with the influence of Freud and other people like that, the notion was that if you're going to cure people of mental disorders such as anxiety and depression, which are probably the two most prevalent mental disorders, what you have to do is to go back to the individual patient's childhood and get them to remember some of the traumatic events of childhood, and this sort of purges the system and makes them better. Okay, the problem with that is that while psychoanalysis has proved of some effectiveness, it's not a particularly effective way of treating people. Okay, so in crude terms, we could say that in recent times, there are two major approaches that are being adopted to treating anxiety and depression. One of these is drug therapy. We have increasingly effective drugs, that anti-anxiolytics that can reduce anxiety levels, and anti-depression drugs, which as the name implies, reduce depression. Okay, against that, we have a cognitive approach, and there's a slight difference there between cognitive therapy, which just focuses on changing the way that people think about things. People who are anxious and depressed often have an excessively negative view of themselves and about the world and about the prospects for the future. And so cognitive therapy, a key part of it, is designed to make people have more realistic and or positive views about themselves and their place in the world. And this is often linked in with behavior therapy. So we have cognitive behavior therapy, which uses everything I've talked about, but also has some focus on changing behavior in ways that are undesirable. Okay, so the key question here is which of these two approaches is more effective? And trying to be as fair as possible, I think it's in general terms, both drug therapy and cognitive therapy or cognitive behavioral therapy, they have both proved approximately comparably effective in treating anxiety and depression, but with one major proviso. They're both effective during the time that the therapy is ongoing. Okay, but of course, patients who are being treated, they don't just want the anxiety or the depression to be greatly reduced during therapy. Obviously, they want to resume normal life, and they don't want the anxiety and the depression to return. So a big difference between cognitive therapy and drug therapy is with drug therapy, you tend to get a lot of patients relapsing over time. That is to say, after the end of successful drug therapy treatment, you find over the months that follow the end of treatment, there's often a very unfortunately high relapse rate, which can be as high as 60 or 70%. Okay, in contrast, cognitive therapy has a much lower relapse rate. And so in terms of the long-term well-being of patients who've had anxiety or depression, in my opinion, I may be somewhat biased, but I think the evidence strongly bears this out. The long-term prognosis is much better with cognitive therapy or cognitive behavior therapy than it is with drug therapy. And I might just mention, which I think is perhaps very widely known, what had typically happened in cognitive therapy is that cognitive therapists have devised a form of therapy that is specific to the particular disorder that someone has. Now, some diagnostic systems have identified something like 12 different anxiety disorders. And so that all becomes fairly cumbersome. It means you need a dozen different diagnosis-specific forms of cognitive therapy. The good news is that over the last 10 years or so, David Barlow in particular, an American psychologist, he has developed what's known as transdiagnostic therapy. That is to say, he argues that the problems that patients with a whole range of different anxiety disorders have, that all of these somewhat different anxiety disorders can nevertheless be largely treated by a common approach based upon cognitive therapy, which he calls transdiagnostic therapy. So as you can imagine, this has proved to be as effective as diagnosis-specific therapy, but it also has the big advantage that it tends to be less expensive because a therapist providing therapy, if you decide you're going to treat everyone diagnosis by diagnosis, you may only have 2 or 3 patients suffering from a specific anxiety disorder. So you have to deal with very, very small groups of patients at any one time. If you treat all the patients with all the anxiety disorders together, then you can have larger groups and you've got a more effective form of therapy. That's the number one thing, and I think I really want to emphasize the fact that hundreds of thousands, if not millions of people are benefiting from the development and continual development and progression of cognitive therapy. Okay, now another area where the cognitive approach has proved effective is in health psychology, where we're all vividly aware that there's been more and more emphasis, not only in the media, but in terms of health psychology, more and more emphasis on the fact that we all need to do our level best to have a healthy lifestyle, which is indisputable. The problem, of course, is that most people find it very difficult. That's particularly true with people who are very overweight or obese. It is notoriously difficult for obese individuals to do much about it, even if they're very well aware that this could shorten their lives and produce all kinds of unfortunate diseases. Okay, so there's that, and yeah, so other sort of lifestyle changes like giving up smoking and so on and so forth. So there's a range of things there. And what is increasingly being used, which has proved surprisingly effective, well, I'll just focus on one, which I think is particularly important. And that's an approach known as an approach based on implementation intentions. So the basic idea here is, well, supposing you're on medication for a heart condition, or someone is on medication for a heart condition, and in spite of the fact that they know it's important to take the pills every day, they're not very good at doing that. Okay, so an implementation intention would mean that ahead of time, you think to yourself exactly what are the circumstances in which I'm going to take the pill that is being used for the medication. Okay, so you could say, you could pre-plan, you have to form the intention. As soon as I have finished breakfast in the morning, I will go upstairs to the bathroom cabinet, take the pills out and take them at that time. Okay, so it's all sort of pre-planned, and this proves surprisingly effective. So what it means is, if at the end of breakfast, if someone says to you, oh, can you come and do this, come and have a look at the newspaper, come and do something else, you have this firm intention to say, well, sorry, of course I'd be happy to do these things, but first of all, I must carry out the intention that I had to take the pills. Okay, so that's very useful. And in terms of people on a diet, so here the sort of thing that you do is you ask yourself, what are going to be difficult situations where I might have far too many calories? So perhaps if someone's got a sweet tooth, they're going to think to themselves, well, that's a real danger if after a meal, towards the end of a meal, someone says, say in a restaurant, someone says, why don't we all have a nice, rich, sweet dessert? Okay, so it can be difficult to resist if it's just sort of sprung on you. But if you've thought about it in advance, so you need to plan ahead of time what you're going to do. So you, for example, you think of some polite way of refusing to have a sweet pudding, and maybe you'll say, well, I'll have a bit of cheese and some biscuits, or but you planned it in advance, because if you haven't had the chance to plan and think about it, then you're more likely to fail to resist temptation. Okay, so again, this is proving within health psychology. This is very much a cognitive approach, cognitive thinking, processing, pre-planning, which is surprisingly effective in allowing you to resist things that you need to resist if you're going to lead a healthy lifestyle. And the third, and perhaps the final approach that I will say something about, which is, I'm not so sure about Malaysia, I don't know, but in many parts of the world has become really important, is the notion of nudges. Thaler and Sunstein in the States came up with this notion about nudges, and it's certainly big news in the United Kingdom, and I guess in many other countries as well. The basic idea is that we all have cognitive biases, and I'll mention a particularly important one in a moment. We all have cognitive biases, and by and large, we psychologists regard these cognitive biases as a bad thing. As the name implies, a bias is when your thinking is not exactly straight. Okay, but the idea behind nudges is that you can gently push people into doing things that are desirable if you take advantage of these cognitive biases. And my reading of the literature there is that the single most effective cognitive bias that has been used to enhance people's behavior in this gentle nudging way is known as status quo bias. That is to say, people tend to be locked into a particular way of doing things or a particular form of behavior, and they can find it hard to change it. So in other words, they tend for the most part to stick with the status quo rather than taking a chance and changing the way that they do things. Okay, now what's been a particularly effective approach here is that certainly in the United Kingdom, until fairly recently, it was the case that you had to opt in if you wanted to donate any of your organs after death, so that they could be used to save other people's lives. Okay, so it didn't happen automatically. You had to make a positive choice that you were happy for your organs to be used to save other people's lives. About 2 or 3 years ago, something like that, they changed it, if you like, taking advantage of the status quo bias. So the government changed it. So the status quo was that your organs after death would be available to be used to allow other people to survive from whatever very serious illnesses they've got, unless you made a conscious decision. And since people are a bit reluctant to make conscious decisions to change the nature of what they're doing, this has proved very effective. I can't remember the exact figures, but there's been a huge increase now in people whose organs will be available after death. And so in the fullness of time, tens or hundreds of thousands of people will survive very serious illness that would not have been the case but for this very simple change based on the notion of status quo bias. And just one other example of that, which has been very effective as well, is the fact that if you tell young workers, you say to them, we strongly advise that you have a pension organized for yourself for the day many decades away when you're going to retire from work, then a lot of young people think, well, I've got a lot of things I want to spend my money on, and I'm not retiring for 40 years or something. So why should I be bothered about thinking about a pension right now? Okay, so what they've done in the United States and the United Kingdom in many companies is to switch this round. In other words, you are automatically enrolled in a pension scheme tied into your work or the government, unless you specifically say that you want to opt out of it. This has also proved very effective because when people they don't have to spend a lot of time agonizing over the decision. It's just things are set up. You will be in a pension scheme unless you say you refuse to. Then people are much more likely to go into a pension scheme and hopefully in the fullness of time derive the benefit from having a lot more money to live on in retirement than they otherwise would have done. I could in a way go sort of on and on about these things, but I think I've tried to identify what I think are the three separate sorts of areas, but the three main areas in which cognitive psychology is having an increasingly beneficial effect on society.